If you've been told to do the traditional clamshell exercise to help strengthen your gluteus medius and you can't seem to do it correctly, this video is for you, especially if you're hypermobile or struggle with body awareness and finding the correct positioning. Hi, I'm Shauna. I'm a weight neutral certified personal trainer, health coach, and registered yoga teacher. I'm also hypermobile. This is a deep dive on the clamshell exercise. I'm going to cover the anatomy of the exercise, form and movement, and show you 5 different modifications and assists that can either be used alone or in combination with one another. Let's get into it. It's important to note that muscles have 2 fibers. Type 1 are slow twitch, and these are for endurance. Type 2 are fast twitch fibers, and these are for strength. Endurance is the same as stability, how much low-level resistance a muscle can handle for an extended period of time. Whereas strength refers to the maximum force output a muscle can endure one time. Many of our muscles are a combination of both of those, some of them weighted much more heavily toward type 1 or type 2. The glute medius and many of our other hip stabilizers are mostly type 1. Aside from being a slow twitch endurance muscle, it's also a stabilizer, not a mover, meaning its primary job is to help hold us in place, not help us move. To effectively strengthen the glute medius and similar muscles, you have to do endurance work in closed chain positions with low levels of resistance. Then you use that increased stability for safe and effective strength training like single leg standing work. One of the most effective exercises for the glute medius is what? That's right, the clamshells. Primary purpose is to activate our hip stabilizers and help change movement and muscle recruitment patterns related to our gluteals. Our hip stabilizers are comprised of our gluteals, our deep external rotators, and our psoas. I bet you didn't know that. I know we don't think of the psoas major for hip stability, but if you look at how it's connected from the spine to the femur, you can see how this plays a pivotal role. General rule of thumb, regardless of which type of twitch fiber you're working with, is that the size of the muscle should be comparable to the amount of resistance you're using, meaning these very small, deep muscles, we're going to use a much lower amount of resistance than we would use if we were just working the gluteus maximus by itself. Not that any muscle ever really works entirely by itself, but if that were our primary target, as opposed to this, where our primary target is the glute medius and those type 1 fibers. Traditional clamshell is a closed chain unilateral exercise. Closed chain means we're doing multi-joint movement with our hands and or feet against a sturdy surface. Think push-ups and squats versus bicep and hamstring curls. And unilateral means we are working one side at a time. Starting on our side with our bottom arm extended, head in line with the spine, actively resting on that arm while maintaining spinal alignment. We want to find and maintain a neutral pelvis here, keeping that very slight arch in the low back. This should also be felt as a lift between your oblique and the mat, whether you can see that or not. The feet should be in line with the coccyx, far enough away to form more of a diamond than a triangle shape when you open your knees. Make sure your pelvis is not caving inward or falling back. You want to stay active in the hips with the leg sockets stacked directly over one another. Someone should be able to stick a pole straight through and hold it there the whole time. As you begin to move on your exhale, think about a pulling sensation at your posterior hip as you pull your knee open. This isn't a lifting or pushing, or even really an open and close. It's a pull. And as you pull that knee open with your deep hip muscles, dig your heels into each other just a little bit. This will help you keep alignment and make the most of the muscle contraction. Use your lower abdominals to hold your pelvis in place and prevent going into an anterior tilt, which will primarily recruit the TFL instead of the glutes. We don't want to do that. Again, imagining we have a pull going through those leg sockets. We don't want our hips moving at all. If you do have a tight or overactive TFL, you'll still feel it working in this movement even with proper form. Another thing this exercise can do is to teach your body to rely on that TFL less and less by improving this movement and muscle recruitment pattern. Last, you want to pull open to your maximum range without compromising pelvic or spinal alignment, meaning pulling open as far as we can without anything else moving. Here are a couple of proprioceptive tips to help with alignment. As a visual body awareness cue, I like to encourage my clients to keep their hand on that top leg socket and make sure they don't see it move. Another thing you can do is line your lumbar spine up with a foam roller and make sure you don't feel movement away from or against the roller. And anytime you feel the pelvis starting to move or the low back starting to arch, you can use those lower abdominals to really hold the pelvis in place. The first modification is slightly tucking the pelvis by holding the lower abdominals in place, which puts us into a slight posterior tilt rather than keeping a neutral pelvis. This is for those who have lumbar issues and need to avoid any bit of lumbar arching and or really struggle to get into the glutes at all. especially if you're quad or TFL dominant. It's almost impossible to access the glutes in this position when our pelvis is in an anterior tilt. So if you're struggling to keep the hips from caving inward while trying to maintain neutral, tucking the pelvis into a slight posterior position helps encourage the use of the glute medius, and it also stretches the TFL a bit at the same time. A little bit safer and more effective to go into a posterior tilt where you can still recruit the correct muscles as opposed to risking caving inward and not getting into the glutes at all. The second assist is to place a small Pilates ball or something comparable between the legs. This is for those who have generally unhappy hips, lumbar spine issues, sciatica pain, and similar. We're doing this to reduce our overall range of motion, which can drastically reduce stress to the hips while allowing us to get into those smaller muscles. The Pilates ball helps by preventing us from bringing our knees together, and as we exhale, pulling our knee away, we're only moving an inch or two, just enough to feel those deep glutes really engaging. From my personal and professional experience, I find internal hip rotation one of the most common aggravators for hypermobile folks, which can make these traditional clamshells painful even though they're supposed to be, quote, the best. If that's been your experience, this modification may be just what you need. Third assist is adding a thigh loop band. This can increase the exercise's difficulty and challenge your muscles as you get stronger. I recommend keeping it about mid-thigh or just above. Getting closer to the knee may cause unintentional strain. Alternatively, you can use something extremely lightweight as proprioceptive input and place the band back where you want to feel the work as a way to help with that mind-body-muscle connection of where we should be feeling that pull in our posterior glutes. That can be especially helpful if you tend to go into your TFL instead. The fourth modification is to do this seated on the floor or in a chair. This is helpful if you're unable to exercise on the floor, struggle to find proper alignment on your side, or resting on your hips is painful. You can maintain the unilateral movement or work both sides at the same time. One of the benefits of unilateral movement is that it allows the mind to better connect with the body, which can be especially important for improving posture and proprioception, but it's not necessary here, and especially if anything about the unilateral movement is painful or uncomfortable for you. This variation does require better overall stability in order to maintain alignment while sitting, but this is a perfectly acceptable place to be if you're unable to do the floor version for any reason. The fifth modification is a more progressed version, which are fire hydrants. These should not be done until you can 1. Feel your glutes in regular clamshells, 2. Have the deep core stability to support your lumbar spine and pelvis from anterior tilting and overextension, and 3. Have proper scapular stability using the serratus anterior to support you rather than the pec major and upper traps. You can also add an assist and further increase the challenge by adding a thigh band. Last, please remember you can combine things based on your body's needs. This is a reason it's so important to me to show you the mechanics and the anatomy behind what we're doing. So you can go into a slight posterior tilt to protect your lumbar spine while keeping a Pilates ball between your legs to reduce your range of motion, and a band around your thighs to increase the resistance a little bit. More than anything, I encourage you to do what feels best and safest for you. If you want more personalized help or advice, schedule a session and we'll chat. I hope this was helpful. Don't forget to like, subscribe, all the things, and let me know what move you want to see next. See you next time.